previous video, we gave you the definition and so of family planning and benefits, and we touched on the different types. So now we are going in depth, or more in depth, with information about the types, benefits, and so on. So the forms of contraceptives, we said, is natural and artificial. Now the natural contraceptive is where we have abstinence, coitus interruptus, calendar method, basal temperature, checking your mucus discharges, and so on. And the artificial is where we have the pills and the injections and so. So the natural method, abstinence. Now I am of the opinion that once you're between the ages of 10 to 18, you should be abstinent. You should not be involved in any sexual activities. Remember, you are in charge. You have control of your body. And at that age, as a young girl, your goals is to be trying to figure out what you want to be in life. Even if you have a little boyfriend or so, we're not saying that you cannot have a little boyfriend, but don't be pressured into having sex until you are ready, until you know that, okay, if something happens, I can handle it. I can get myself out of that situation. If something happens, I am working, I am employed, I have the means of taking care of a child. If something happens, I can take full responsibility and accountability for what comes out from that. That we're not saying things doesn't happen. Yes, unforeseen circumstances come about and unintended pregnancies happen. But some of us, unfortunately, we do not have the means and the support to get out. So abstinence is 100% effective, and it should be practiced for ladies, young ladies between the age of 10 to 18. Coitus interruptus. Now, coitus interruptus, or what we call the pull-out method, it is not effective. It is a method that is not encouraged as it is not effective. This is when male and female are having intercourse and the male pulls out instead of ejaculating inside. No, it is not effective and is not encouraged, but it is a natural way of preventing pregnancy. It is not encouraged. Another method is the calendar method. Now, I am of the opinion that once you are a young lady seeing a period, you should be able to calculate your cycle. Now, people have different types of cycle. Now, the normal cycle is a 28-day cycle. People have 21-day cycle to 40-day cycle, but the normal is 28. Now, day 1 starts from the day of your period. So, day 1 through 7, you have your period, right? From day 7 to day 12, you have safe days, what we call. Now, day 12, 13, 14, 15, 16, these are your no sexual zone days. They're not safe. Day 14 is the day of your ovulation, so very high risk of getting pregnant. Day 12, 13, 14, 15, 16. From day 17 to day 28, these are your safe days again, and your cycle repeats. Let's go over it one more time. You have a 28-day cycle, which is a normal cycle. Some people have 21, some people have 33, some people have 40. So, day 1 starts from the day of your period. Day 1 to 7, these are period days. Day 7 to 12, these are safe days, what we say. Day 12, 13, 14, 15, 16, these are your high risk days, as day 14 is your ovulation days. Now, the reason we say these 5 days is because naturally the sperm cell lasts 3 to 5 days in the human body. Once ejaculated into a female, it stays up to 5 days, depending on the man, his age, his health, different aspects. So it all depends on the individual. The sperm cell lasts up to 5 days. Now, because day 14 you have your ovulation day, 15 and 16 the egg is going into the uterus to be planted. Now, if around that days you have a cell or sperm cell lingering, you can get pregnant. So that's why we have the 5 days where we say no intercourse or very high risk days. Now, if by any chance you happen to have intercourse on these 5 days, you can take an emergency pill, an emergency contraceptive. This is what it's for. So day 14 is your ovulation day. So 12, 13, 14, 15, 16. From day 17 to 28, again, you have your safe days, and your cycle starts day 1 again. Once it is done correctly, it is 97 to 99% effective. But it's suggested that you do a trial phase for the first 3 months to ensure or to see which type of cycle you have, what days, how many days, on your ovulation day, your body temperature, take notes, and you get a calendar and you mark out your days, your cycle, your symptoms, and so on. So this is how you know how effective it is, because after the 3rd month or so, you should be able to know that, okay, this is happening, my period's about to come, my ovulation is starting, just by the way you're feeling. So 3 months trial, and then you start using that calendar method. Very effective. So once you are having sex, once you are a female, you should be able to calculate your period, sexually active or not. Right? Other natural methods include the basal temperature. Studies show that once you're ovulating, you have a higher temperature than your normal body temperature. So calculating your basal temperature, checking your vaginal discharges. So your mucus when ovulation is very clear, very sticky. So you should be able to tell that, okay, I'm ovulating by the type of mucus you are discharging. So these are all natural ways of calculating or practicing family planning or contraceptive, natural contraceptive. The artificial contraceptive are the pills, the injections, the IUDs, intrauterine devices, the condoms, male and female, the patch, ring, cap, diaphragm, vasectomy, or tubal ligation. Vasectomy for the male, where he snips, and the tubal ligation is where the female ties fallopian tubes. Now these are all artificial family planning. Now, like with everything else, riding a bike, taking antibiotics, taking painkillers, treating diabetes, there is a bad. So there are side effects for everything we do in this life, unfortunately. And there are side effects of taking contraceptive. But to me, the good outweighs the bad. Some of the benefits of taking contraceptive are the treatment of certain types of diseases, prevents cancers, treats endometriosis. Now, endometriosis is where the uterine sheds a lining, but instead of flowing as a normal period, it attaches itself to outside of the uterus or to the ovaries and different parts of the body. This is a very painful thing for women to experience, and some of the symptoms are painful period, dysmenorrhea, painful sexual intercourse, pain while passing feces, irregular bleeding. Endometriosis is a condition, unfortunately, that is not caught easily. Now, women of any age can contract endometriosis, and so if you're experiencing any of the symptoms, you should see a doctor. One of the major treatments of endometriosis is hormonal contraceptive pill, and it is very effective in treating it, as it stops the uterus from shedding, which stops all the other. So the major benefits, as we said, it treats the endometriosis, it prevents certain type of hormonal cancers, it prevents a painful period, and the list goes on. The good outweighs the bad as when it comes to contraceptive and taking contraceptive. Now, unfortunately, we come from a society that condemns most of the time or frowns when you speak openly about family planning. You're viewed differently if you speak openly about taking family planning or practicing family planning, and that stigma should be broken, in my opinion. Now, we are given the opportunity, or man was given the knowledge to create a method to prevent overpopulation of the world. Now, I'm not saying, because some people, the choice is yours. Some people would choose to have their children, and some people would choose to wait. The choice is yours. Now, where you see yourself in the next 5-10 years is what the choice you ought to make. So if you see yourself in the next 5 years with 20 children, I'm just joking, but having children, having 5-6 children, that's your choice. If you see yourself in 5-10 years career driven, not ready to have children yet, then you know the choice you have to make. The choice is yours. Coming off of contraception, when you are ready to come off contraception after taking the artificial ones, for instance the pill and the injection, so that first period that you experience after coming off of contraception is called the withdrawal bleed. Now the period after that is counted as a normal period, and so you should start coming after that. Now, coming off contraception, you are very high risk of getting pregnant. Some people get pregnant immediately after stopping contraception, and some people get pregnant later on. It depends on you. Now, some of the side effects of coming off of the contraception are pregnancy, delayed natural cycle, PMS symptoms might reappear, longer, heavier periods, weight loss, frisky feelings, you feel kind of differently. If you're having painful period, it comes back. If you were having headaches with the period, it comes. Now, when it comes to birth control, there can be a lot of confusion and a lot of hearsay and unfactual statements and so on. But hormonal contraceptive does not cause infertility. No matter how long you were on it, no matter the type you take, it does not cause you to be infertile. Alright? Now, there's a lot of bad things, as I said, when you research contraception, and this is only because there's a lot of people that are against contraception or against family planning, and so things are put out there for you to read, and that sometimes deter you from getting the information or getting the treatment you require. If you are uncertain, you speak to a medical professional. There's nurses, doctors, there's family planning clinics. You go in there and you seek the correct information. If you're not sure of what you read, like I said, you go in and you get the information from the people that are trained. Now, as we said in the previous video, the major benefits of taking contraception: not only does it prevent pregnancies and treat conditions and diseases, but it empowers you as individual. Women empowerment. You have the choice, you have the rights, you can make the decision. Once you are sexually active, you should get yourself into a family planning clinic. Once you're sexually active and not using protection, you should get yourself into a family planning clinic. Family planning is for everyone. Male, female, doesn't matter. Some of the types that more lean towards the female, but it is for everyone. The knowledge is for everyone. Education is free. Educate yourself. Ask questions. When you go into a family planning clinic, they don't just jump into it. They educate you. They help you choose the right method for you. They do tests and so to ensure that you are able to take the method. They ensure that your blood pressure is okay. They ensure that your temperature is okay. Ensure that bloods are taken, tests are done. Make sure that you are healthy before you are started on a cycle or started on a type of contraception. Don't let anybody tell you or defer you from getting the information that you require. Break the stigma, break the cycle, end poverty. I mean, we see the situations where our mothers have had children early, and because of poverty and that cycle, she continue having children because she has to, put herself out there to feed the others, and so another one comes and another one comes, and then you come in. You go have sex unintendedly, have child at age 14. Cycle starts for you. You have one, you have another one, you have another one. No one is thinking, you know what? Okay, I have one, let me go get myself into family planning clinic, because of the stigma. It is not a gun given to you to shoot yourself. Family planning is not a bad word. It is an opportunity to help yourself. It is an opportunity to better yourself, to break the cycle of this continuous trend that happens in the rural communities, in the African communities. Get your education. That's all you need to do. Educate yourself about it. It doesn't have to be that you take an artificial method, but naturally, if you're going to have sex, know what you're doing. Most of the family planning methods in the Caribbean are free, thankfully. And so all you need to do is to go in. Now, sadly, in the Caribbean and African communities, there are a lot of maternal child deaths. This is because we do not have the facilities to deal with certain types of conditions that we may encounter as professionals. Not only do we not have the human resource, but we do not have the material resource to deal with certain diseases or conditions that we encounter. And it's sad, yes, but to prevent this from happening, take the first step. Let it start with you. And then we go on and we bash the system and we bash the healthcare and the government. Oh, the nurse should have done this and the nurse should have done that. But the nurse doesn't have the equipment to deal with this. The nurse didn't have the manpower to deal with this. The nurse didn't have the training, or the extensive training to deal with that situation. We come from a Caribbean, third world countries. We don't have the equipment to deal with some situation that we are faced with, but yet still we are blamed most of the time for the outcome. The means it's actually given to you. In some other places it has to be bought, but it is given to you free. It is a choice at the end of the day. It is your choice. It cannot be forcefully implemented onto you. It has to be a choice. You have to make that choice. If you are sexually active as a teen, get yourself on a method to prevent that cycle. It is sad that some of us, we're not able to move past that situation. I had a child at 19. He's now 13. I am a registered nurse. I've traveled. I've done what I've needed to do because I had that support. Because I didn't let that stop me. Yes, it was unintended, but you know what? I accepted it, and I decided that, okay, it stops there until I, as an individual, is ready, until I can see myself being able to take care of a child on my own without help, without support, or with just the support of my partner. But if you do not have that support system, if you're already struggling, get yourself some help. The minute time you start speaking about family planning, especially to Grenadians, you get this drawback, and I believe it's lack of education. It's not that, it's just not normal for people to just react so every time you say family planning. It's not normal for people to react so every time you mentioned the topic. No, I believe it's lack of education. It doesn't take one. Everyone is involved. Everyone should be involved in family planning. It is not just the female, it's also the male. And remember, young ladies, you have a choice. If you're not ready, don't be pressured into doing something that you are not ready to do. If your goal is to have children, then that's fine. If your goal is to wait and see what life has to offer, that's also fine. Remember, it starts with you. This is a discussion topic, so feel free to leave a comment below if you don't agree with what I say, if you have anything to add. This is discussion. Remember, this platform is used for education purposes, and so this is just dissemination of general information. You go there, do the rest, and get the information you need. Thank you again for joining me. Chats with Desiree. I'll see you in the next one.